Doctor, may I confirm your name?
Yeah, my name is Muhammad.
Okay, nice to meet you, Mr. Muhammad. Today I would like to examine your knees. This examination involves I have to look at your knees and also I have to feel your knees and doing some tests in your knees. Is that okay with you? Do you have any pain?
No.
Okay. Do you need any gentleman to attend our examination today, Mr. Muhammad?
What?
Do you need anyone to attend this examination to help you?
No.
Okay. I need from you to stand up. Do you use any working aids?
No.
Okay. I need from you to stand up and to work in you. Oh, I will support you. Okay. Okay. Thank you. We came back, Mr. Muhammad. Okay. Great job, Mr. Muhammad. Okay. I need to ask questions. Okay.
Okay.
Okay. Right now, I want to have a look at your knees. Okay. I want to look it from front. Okay. Thank you, Mr. Muhammad. Right now, I want to look from the right side. Okay. Thank you. From the other side, Mr. Muhammad. And if you don't mind, I want to have a look from behind. Okay.
Okay.
Okay. Thank you. Thank you, Mr. Muhammad. Right now, I need from you to lay down in this couch. Okay. Thank you, Mr. Muhammad. I want to have a look at your knees. Okay.
Yes.
Yeah, continue. Don't stop. Yeah.
Okay. Okay, Mr. Muhammad, thank you. Right now, I want to feel your knees, okay?
Okay.
I want to feel your temperature.
Okay.
Okay. Thank you, Mr. Muhammad. Do you have any pain?
No.
Okay, I want to feel your joint, okay?
Okay.
Okay, can you bend your knee? Yes. Thank you, Mr. Muhammad. Okay, that will be. Okay, thank you, Mr. Muhammad. Okay, right now I want to use this tape, I want to use it.
Okay.
I want to use this tape, okay, to measure your side, okay?
Okay.
Okay, thank you, Mr. Muhammad. Okay, thank you. Right now I need from you, Mr. Muhammad, to doing some to squeeze your knee. Okay. 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 Thank you. Okay, thank you, Mr. Muhammad. Okay. Other knee. Okay, Mr. Muhammad. Right now, I need from you to move your knees, okay? Bend your knee as much as that you can. Okay, thank you. The other knees. Okay, thank you. Relax your knees. I want to do the same things by my hand, okay? Do you have any pain?
No.
If you feel any pain, let me know, okay? We'll begin to resume. Thank you. Okay, thank you, Mr. Muhammad. Right now, I want to do another test. I want to do some special test for you, okay? We need from you, Mr. Muhammad, to bend your knee as much as that you can, as 90 degrees. Yes, bend your knee and side at 90 degrees. We want to see. Let's side at 90 degrees. Okay. Okay, I want to see it from. Okay, thank you. Right now, I want to pull your knee gently, okay?
Okay.
Okay, relax your knee. Thank you. Okay, thank you. The other knee. Okay, thank you. Okay. Right now, I need from you to bend your knees. I wanna sit. Okay, I wanna sit here. I wanna pull your knees gently. Okay, thank you. Thank you, Mr. Muhammad. Thank you. Thank you, Mr. Muhammad. Right now, I wanna feel your knees. Okay, I wanna put your knees in my armpit, and I wanna push your knees. Okay, I wanna put your foot here. Okay.
Okay.
Okay, thank you, Mr. Muhammad. Thank you. Other knees. Okay, thank you. Right now, I want to do the last test. Okay. It's a little uncomfortable. It's important for diagnosis. Okay. Okay, bend your knee as much as you can. Okay, thank you. Okay. Another. Okay, thank you. Other knee. Okay, thank you. The other knee also. Side. Okay, thank you. Right now, I finished my examination.
Yeah.
So, sir, do you need me to help you to read this?
No.
Okay, thank you, Mr. Muhammad. You have been so correct.
Okay.
Thank you.
You have 40 seconds. You finish before the time. Good job. Muhammad, do you want to start the questions? I will put the timer for 3 minutes.
Okay. Present your case, please. Present your case, please.
Okay.
Hello. Hello. I can't hear you. Could you please present your case?
Okay. Can you hear me right now?
Yeah.
Yes.
Okay. Today I examined Mr. Muhammad, 30 years old, presented with knee pain. At examination, the patient has antalgic gait. While I'm doing examination, the patient has tenderness at medial side of his right leg. The patient has positive Lachman test and negative. The patient has positive Lachman test and negative anterior and posterior drawal test. So my leading diagnosis, the patient has ligament, meniscal injury, medial meniscal injury.
Okay. What joints would you examine next?
The joint I have to examine next, the ankle joint and hip joint to exclude the referral pain.
Okay. And what is the other differential diagnosis?
The other differential diagnosis, the patient has anterior and posterior cruciate ligament, medial collateral ligament, and also the patient might have osteoarthritis, knee osteoarthritis.
Okay. And what investigations would you request?
First, the first investigation I should request hematological investigation in form of complete blood count, inflammatory markers, CRP and ESR, and also the patient need imaging investigation in form of chest, in form of knee X-ray, lateral and anterior posterior, weight-bearing X-ray, and also I have to do MRI to exclude.
Okay.
Ligamentum.
Why you need to do MRI? What would you assess on MRI?
Looking for if there is any meniscal injury or intensity of the ligament injury, or if there is any ligamentum tear, and to exclude the.
Yeah, what else? Besides meniscus and ligamentum injury, what else?
Soft tissue injuries, other soft tissue injuries.
Joint fusion and bone edema. Okay. And how you would manage this patient?
This patient, first I have to give the patient advices. First, either to be operable or non-operable, starting by conservative management. Either to give the patient analgesia and also rest of the limb and limb elevation, giving the patient interarticular, gives the patient, reverse the patient for physiotherapist, and if there is no improvement, shifting for the surgical management.
Time finished. But continue. 6 minutes past. 3 minutes past, I mean.
Yeah.
Continue your answer.
What's your operative management?
Operative management by doing arthroscopy, assessment, and meniscectomy.
Okay. If your patient has osteoarthritis, what would you find on exam?
The examination there will be decreasing range of movement, and also crepitus in active movement, in active movement, crepitus in passive movement.
Yeah, that's enough, doctor. What are X-ray signs of osteoarthritis?
Decrease joint space, and also the patient may have osteophyte and subchondrial sclerosis and subchondral cyst.
And how do you manage knee osteoarthritis?
Either to be conservative management by decreasing weight, by exercise, decreasing weight, and give the patient analgesia, rest, limb rest and rest and limb elevation. And also we have to shift for surgical management if the
Before
conservative
surgical, what is the medical treatment for osteoarthritis?
give the patient analgesia and intra-articular steroids. After that, shifting for surgical management by doing
Yeah, arthroscopy. Okay.
Arthroscopy, high tibial osteotomy, or total / partial knee replacement.
Okay.
replacement.
Yeah, this is the last question in this session. First, thank you
Yeah.
very much for participation. Let us review from the beginning.
What I just want to know his name again, Muhammad.
No,
An-Noor.
An-Noor, very good job. Why are you hesitant?
I'm not well prepared myself. I'm not practiced.
No, that's yeah. Muhammad, start the
Yeah,
comment.
let me
Yes.
start with positive thing. An-Noor, you introduce yourself in a very nice way, and you show empathy in all the station. And I am so happy that you explain in step to your patient. So from the beginning, you said, hello, my name is An-Noor. I am one of the surgical doctor. And you explain your examination. You start by looking from all the sides of the patient. And I am so glad that you asked about the walking aids. Then you ask your patient to walk and come back. You start your palpation by checking the temperature, which is the first thing and most important thing, because you wanted to exclude any hotness in the knee. And Noor, before all that, why you didn't wash your hands? It's a crucial point. It will give the examiner bad impression from the beginning. So you should wash your hand before starting examination. Regarding the temperature exactly, you should put your dorsum of your hands in the knee joint exactly, then above and below. And in the palpation, you should organize your palpation. You should start from the medial or from the patella, then medial and lateral joint lines, then tibial tuberosity, then fibular head, and then popliteal fossa. Make it organized, because examination are the mark of professionalism. They're the 4 marks for professionalism. You check the quadriceps bulk, and you check the effusion by Milken test and cross fluctuation test. Yes, you asked about the movement, and I am so glad that you check for crepitus while putting your hands in the knee joints. But regarding special test, Noor, you should start by anterior and posterior drawer test. And you should do it at the same time in the knee joint of the patient. I saw you did the anterior drawer test at the right leg, then in the left leg. Then you did the posterior drawers test. Do it both in the first knee and then the next knee. Regarding valgus and stress test, you did it in the very nice way. You explain the patient will be a little bit uncomfortable. Regarding McMurray test, and Noor, okay, you should bend and rotate leg while straightening it. Can I show you from the school? Let me show him from the school.
While you're
Okay.
opening, Muhammad, while you're sharing the screen, I will just mention quick points.
Okay.
While you're opening, while you share the screen. Very good, An-Noor. I will give you 8 out of 10. That's a very good performance. You're going to pass this station if you had you on your exam. You said I'm one of the surgical doctors. Most of the doctors say I'm one of the exam candidates, which we disencourage. We always tell our students to say I'm one of the surgical doctors, because you are simulating a real life situation. It's not like an exam. You were very professional. You thanked your patient multiple times. You explained everything for him. I think you need to practice the presentation more and more. Most of the students don't practice the session. They will say, I will come to the exam and I will just say it to the examiner. That doesn't make sense. When you see, like, the first impression between you and the examiner is the presentation. So the moment you open your mouth to the examiner is when you present your patient. So you have to practice presenting every single examination and every single history. Your performance was beyond brilliant, but when you presented, there was some silent period. Do you agree with me, Anur?
Okay, thank you.
Yeah, so try to present more. That's what I would say, because this will give a very good impression to your examiner.
Okay, thank you.
Muhammad,
Yes.
are you able to share the? But
Yes.
you're gonna pass this station for sure. It's obvious that you memorize the station and you read every single question of it. And as you know, it has two scenarios, and we asked you about both scenarios. So even if you have it, it's gonna be fine. Muhammad, you wanna show him McMurray test? Can you please show it, and then we're gonna move to the next station
Yes.
immediately.
This is a new station. Yes.
So this you can increase the screen, Muhammad, just to show the McMurray test quickly, and then we're gonna move to the next station.
You see, Ahmed and Noor, you should hold the foot from the lateral side and the knee from the lateral side. Okay,
Yeah.
and bend it and rotate leg while straightening it. Okay, look.
Okay.
Then from inside, the foot from the medial side and the knee from the medial side, and bend it while straightening it. Okay.
Okay.
All right.
I wanna ask
Okay.
a question.
Okay.
When I'm examining medial collateral ligament, my thumb will be in the medial side or on the lateral side?
Hello? Yeah, from the lateral side. While you need to examine the medial collateral ligament, you should put your hand in the lateral side.
My thumb in the lateral side or my
Yes.
other the rest of. Okay,
Yeah.
thank you.
Okay.
All right, good, Anur. Good, Muhammad.
Ali?
I think we have 15 minutes. We can move to the next station, Muhammad.
Yeah, just I wanted to give him quick tips for the presentation.
Yeah.
Noor, when the examiner asks you to present your case, start by the patient name and age. And if you forget the patient name and age, you can say, I did the clinical right knee examination on this gentleman, without mentioning the patient name and age, okay? If you forget. And then start by the compliant, which have a pain in his right knee. Then mention the positive signs first, then the important negative. And jump immediately to your diagnosis. So my main diagnosis is medial collateral ligament or medial meniscal tear. And also I will consider, don't let the examiner ask you what is your main differential diagnosis, what is your other differential diagnosis, because this is consuming of your time. Okay? So should we move to the next station, Ali?
Yes. Who is willing to practice the next station? It's gonna be the same. Good, Anur. Thumbs up. That's a good presentation. I want you to just continue with us. You just need some improvement in the presentation. That's it. Next station is
Ankle joint examination.
ankle joint examination. Who wanna practice it? You can just raise your hand. And because the meeting will finish in, I think, 20 minutes. If there's nobody willing, Anur, you can take it too if you want, because you already did the first one.
Okay, I don't mind today.
Yes, anyone willing to take the station, or we're gonna give it to Noor if no one wanna practice? I can't emphasize enough the importance of practicing. Like if you just watch us 10 times, that will not benefit you unless you practice it. Okay, Noor, can you do? Yeah, let's do the next station.
Yeah, the scenario,
Okay.
Noor, is a 25 years old man present with pain in the right ankle after twisting it during a football match. Okay.
Muhammad, the meeting will finish. How about you create a new meeting?
Okay, let me.
No, we can finish the station, Ali.
Okay, let's do it.
Calling our candidate.
Okay, open your camera, Noor, please.
But the time will not finish for the discussion, Muhammad. I don't think that's a good idea.
Okay. So we will create a new meeting, guys. Just 10 to 7 minutes, and we will come back.
Noor,
How are you?
don't go away. You're gonna do the next station. You can just bring your friend, and then we're gonna start.
Okay.
I just want to ask you a question. So you did a very good practice with your friend. Do you agree of this? It was recorded already. You agree with that, right?
Yeah, I agree. Because I want to ask him. Do you agree this is recorded and a lot of students will show it?
Yeah, I agree.
Okay, he agreed.
Okay, fine. All right. Let's do the next one, Muhammad.